Hi, my name's Waylon. I'm a street outreach nurse here in Victoria, and I'm going to be talking about HIV or human immunodeficiency virus today. So, HIV is a virus that attacks the body's immune system, so the part of the body that fights infection and disease. It's passed through blood and bodily fluids such as semen, pre-ejaculate, vaginal and rectal fluids, and breast or chest milk. It's most commonly passed through sex or sharing needles or other equipment to inject drugs, including steroids and hormones. Um, it can also be passed to a fetus or baby during pregnancy, birth, or breastfeeding by sharing needles, or to get tattoos, or to get body piercings or jewelry, or by sharing acupuncture needles as well. It can be spread by casual contact, such as kissing or hugging or sharing a drinking glass with someone who has HIV. When people do get HIV, it's common for them not to notice the symptoms just because they're pretty general flu-like symptoms. So we're looking at fever, sore throat, headache, muscle aches, joint pains, and swollen glands. These would appear about 2 to 4 weeks after coming into contact with HIV, and it's called seroconversion illness. The only way to know if you have HIV is to get tested. If you know you have HIV, then it allows you to get treatment and the care that you need. The tests themselves, there's 2 different tests. One is a standard laboratory test using a blood sample taken from the arm. The results are usually available in 1 to 2 weeks. The other test is called a point of care or rapid test, where it takes a drop of blood from your finger. The results are ready in a few minutes, and if the point of care test indicates HIV antibodies may be present, then a standard blood draw would be required as well. Most tests are accurate about 3 weeks after you come into contact with HIV, but it can take up to 3 months as well. With that being said, if the test is negative and it's been more than 3 months since you've been exposed to HIV, you likely don't have HIV. If it's been less than 3 months, since you may have been exposed, it may be too early for the test to detect the antibodies, and you need to have another test 3 months after the exposure just to be sure. If the test was positive, HIV is managed with medications called highly active antiretroviral therapy. Most people living with HIV are treated with about 1 or 2 pills a day. With getting early treatment, it makes it less likely to have other health problems and helps keep your immune system healthy as well. Without treatment, HIV is going to weaken the immune system and make it easier for you to get infections or diseases or different cancers that a healthy immune system would be able to fight off. If left untreated, it can become a serious disease called acquired immunodeficiency syndrome. Having HIV, though, does not mean people have AIDS. Some ways to prevent HIV is by using condoms and lube. If you have HIV and aren't on treatment, it's good to talk to a healthcare provider about starting treatment to protect yourself and then also to help prevent HIV transmission. If you're using substances, use new needles and other injection equipment every time, making sure that it's new, not sharing. And if you're having tattoos or body piercings done, making sure that it's properly sterilized equipment, as well as new equipment every time as well. Not sharing sex toys is also a good way, just because there can be fluid transference. If you are sharing, use a new condom on the toy for each person. For folks that are at higher risk for HIV and they're HIV negative, there is oral medication that people can take called pre-exposure prophylaxis, and it can help prevent your body from getting HIV if you've been exposed, or if you're having some risky behaviors. Sorry, that was not a good one. So yeah, to help reduce the risk of HIV, you can take antiretroviral drugs called PrEP or pre-exposure prophylaxis, and that's if you don't have HIV. Chat to your healthcare provider and see if it might be right for you. If someone believes they've been exposed to HIV, there is post-exposure prophylaxis. These are drugs that are also antiretroviral therapy. They have to be started as soon as possible, ideally within 72 hours after being exposed to HIV. It's available at most ERs, and they would be able to advise about whether or not the medications would be helpful for you. The big thing with HIV and any other STI is that people can have it without knowing it because the infections often don't cause symptoms. You can't assume that you or your partner know if they have HIV or any other STIs just based on symptoms alone. The only way to know for sure is to get tested and having a conversation with partners about what safer sex means to them. It just helps to make sure everybody knows what to expect.